Now, I would like to invite on stage Dr. R N Wahi, a veteran homeopathic practitioner since 1967 from Delhi, the senior most leader of NJH and also South Delhi Homeopathic Association. A great round of applause for Dr. R N Wahi.
First of all, it's important to pay tribute to Dr. Vishpala. A lot has been said to her about her. My association with her came, sometime in the years early 2000. When I had joined South Delhi Homeopathic Association, and the pair of mother and daughter, they both came. They also gave a theatrical presentation. I don't remember much about that. But then at that time I was thinking, are they physicians or they are theatre artists? The drug most likely was described as Grashiola. Anyhow, then after the death of the founder president of the SDHA, I was given the responsibility of carrying on that work. And since then, we became much more closer, and to the extent that once, I tried to her, Kesh Vishpala, now you have trapped me to become a life member of NGH. So, now, a lot of things have been said. I need not repeat that part. It has already been given in the memorial issue, which has been now online. The best tribute to her, what I'm telling of the perfectionist part of her. The best tribute was given to about her by Dr. Divan Harishchan. He was presiding over a session, and when the lecture was over, he said, the presentation was very much like ladies' garments. As short to keep excitement on, and as long to cover the essentials. That was the best tribute, which Dr. Vishpala got. At in our last meeting, it was only in the month of July. Everything was all anticipated that where we are leading to. But anyhow, that was what I wanted to say. Now, since, it's an academic part as well, I will share, I could not prepare the presentation because of the time availability. But interesting cases as to how we go sometimes, beyond the case taking and how things, should be dealt with. We should talk in outer box, as it is called. So now I would stay here. Common factor in one of the, rather three of the cases is that they are all family members. First time it was the head of the family, so-called, person, working in an IT company, chronic case of allergic rhinitis. He says right from the beginning, I said maybe it was even 2 or 3 years. That's what I remember. Job is in a multinational company of marketing, IT, and with a very small, at what on eyelid. Borderline diabetes. He is a foodie person, overeating, can't control. And even during the lot of mental stress, he is having craving for food. Fear. On one hand, he is lazy, craving for food, as we had mentioned, likes spicy, and at the same time, fear of doing things. Quite a lot of confusing case. And then, highly emotional, gets depressed easily. Contradiction aggravates. But he says he handles them professionally, prefers warm food. So, skin was dry, exfoliative dermatitis was also there, and very much punctual type. The case was quite confusing, so we decided to go for a reportization. And ironically, the drugs which were giving spongia, sulfur, lycopodium, oron, ignitia, carcinosin, etc. So there again, we were not satisfied as to what should be done. But then finally, we chose headache, dryness of the skin, tendency to coryza, anxiety, thrifty, and at the same time also he had mentioned erectile dysfunction. Now, what we decided that, he's still suppressing a lot, he's not revealing much more. So an experiment was done, and Natramur 1M was given, and for his satisfaction, even Damiana was given. Later on, this was at 16th of October 2023. Lacrimation was very common, and profuse, he is unable to control, but not without of any emotional reasons, as he claims. We thought, okay, Natramur is not helping. We proceeded still deeper. We went to silica. 16th of December, he came again. He was partly satisfied himself, so he brought his family also. Because of the recurrent problem, we decided to give a dose of tuberculinum. Natramur we shifted in physiological form, 12x potency. Now, the interesting thing about the comes. Wife, she was a freelance journalist, but she says, now I'm completely a... And she was a working journalist, with a very reputed channel. Anticipatory anxiety with stress, but then she claims she handled the situation very well. Menopause, 49, so it has started. And she says, right from my childhood, I have been having a stressful life. My family life, right from the beginning, from the parent side, it has all been very disturbed. Because father, he had married twice, and then, there were divorces also. In her case also, she married, then there was a divorce, and she married this person later on. Lack of sleep and claustrophobia, that was very marked in this case. Not much about that. But then, what we did, in her case, we thought, in her case also, because of stressful family life, and which has gone quite deep. Early age, she has been having this problem. So we gave certain. Then, subsequent visit, she said there was a history of brain tumor during delivery, forced delivery, resulting in left parts में इसको जो है pain काफी weakness and it's all that. And she says, I have yet to reconcile to my mother's demise. Sleep was comparatively improved in the problem. TC has been fair subsequently. This was on December. Then they had brought their son also. Son again, history of allergy bronchitis from birth. Sneezing, they were marked. Worse, pollution. And pollen was, exciting in this particular case. Boy, he's aged 16. Playing football, not drinking milk. Anger, too much anger. During, observation, I could observe there was a lot of miscommunication within the family. So besides the medication, I said, important thing for all of you is that you must have proper communication within yourself. Now this was the thing, which helped. Only medicine was not helping. So communication, it extended to that much improvement that 24th of December, when I was at Lucknow for another conference, I got a phone from her. Sir, there was a party in our house. Normally I used to be too much worried, too much anxiety as to what is going to happen. But this time, only I wanted to tell you that I handled the gathering of 35 persons without feeling even tired. So that was the thing. My point was, in this case was, okay, it is equally important. Simply giving medicine is not sufficient. It's important that we must try to know the communication or how bondings are within the family. So this was an out-of-box suggestion which helped in all of them. Again, I think only it was 4 or 5 days back. Then she said again, sir, now I don't have any stress. I can do a lot of work, and even the gatherings I am able to handle. This was the reason I wanted about the family part. Then another case. This is a case of a girl, 21 years, and common complaints. Acne is very common, so they came. Now, in this particular case, she was having acne for past 8 months, and they have consulted the dermatologist. Says, no, there has been no response. On the contrary, my skin is becoming more and more black. Previous history, there is history of developmental milestones which was not very clear. Any maternal stress is not known. Then, the parents reveal this cleft palate surgery at the age of 1.5 years and cochlear implant at the age of 3.5 years. Very strong physically, IQ 120, and she has won very many international awards. Because of the disability, she was in a different school, highly emotional. But my problem was in that case was, okay, now why with such, there have been surgery 3 times for cleft palate, then cochlear implant. So what could be the reason? I asked mother, okay, now I want to know about your history. Just a minute, not much. So in that case, is revealed, okay, sir, we have not revealed it to anybody so far. She is our adopted child. So we do not know, okay, what has been the maternal history in that. Only on one thing, okay, there was a history of congenital deformity. I prescribed luticum, cyplinum. And after that, and only last week, when she came, she was very happy. Even the color of the skin is going, acne they have improved, but pimples are coming permanent. I gave nothing but Echinacea Bhagavad tincture, and I'm confident that now she won't be needing any medicine. Because Sushma is reminding me, Sushma, you were telling me about 10 or 12 minutes, 15 minutes. I don't think I've taken more time. Nevertheless, no. I was, getting nervous, because I mean, Dr. Praveen, she had to ask whether she's still alive or not. I guess, I'm getting scared, when she repeatedly sees me like that. And now, please bear with me. Then, another case again of in a family. Person, I'm more likely, they're family physician. And in case of the male, there was a problem of alopecia patches, which were there. But response, it was with the normal common remedies, enema, etc. When it was giving, it was not coming. So I shifted to, now one thing more I would like to say, that many times, people are saying, okay, external medicine, nahi dena hai. But for cases of alopecia, and I think it is given in boric, Cyanothus americana mother tincture for application. So in the case of this male, the response came from thallium metallicum. Then, once then again, it was not very much late. quite recently, as back as 3rd of October. He came, said, okay, so uncle, I want to consult you regarding my wife, Vandana. This lady, I knew her since she was working with HSBC, and later on she left the job. There is a lot of depression in her case, and we have consulted any of the psychiatrists. No response is coming. There were hypopigmentation, and she had developed diabetes, blood sugar level had increased, constipation, nausea, dry coryza, markedly low feeling, lethargy, sleep disturbed. And the biggest problem was that there was a fear of death, but without any cause. No, not much known about that. Now, in this case, they had got her daughter married during COVID time. They said, okay, uncle, we can't invite. I said, just don't worry. COVID is the best opportunity for many of such cases, because, you won't have to, you can't satisfy all the invitees. Complaints will be there, अरे तुमने मेरे को नहीं बुलाया. मैं कहता हूँ, this is best opportunity, कोई complaint भी नहीं करेगा. आप 10-15 लोगों को लेके जाओ, शादी करो. It is over. Now, in case of both, the reason came, the cause of depression was that they are missing their children, both, although now both are married. Daughter has gone, now she is in Singapore. Boy is also somewhere, but then he says we are always anxious about that part. साथ में थे तो कुछ भी नहीं था. But now, when they are apart, उनका डर रहता है कि अब मैं मर गई तो क्या होगा, उनका क्या होगा, और that thing, so on and so forth. So I gave CPR to both husband and wife, and the response is coming. This was all I wanted to say. How many times, the number of medicines, they do not help. You still remain confused. But when you think beyond medication, the advice, etc., then this definitely helps. So, thanks. Sushma, I think I have done within my time. Okay, thank you.
Thank you so much, Dr. R N Wahi, sir.